Hello, everyone. Thank you all for coming. Um, Today, I'd like to talk about something that's not code related necessarily. I thought about putting some JavaScript in here, but that might have been too depressing. I'd like to talk about burnout, depression, anxiety, and generally speaking, mental health in IT. The reason that I'm giving this talk is because I'm someone who likes to learn things, learn new things, write about them, talk about them. And personally, my best way of learning is learning by doing. You see where this is going. So 3 years ago, I burned out properly. And I learned a few things on the way, which I would like to share now. There is another reason why I'm giving this talk, is that I know quite a few people that have burned out, that have mental health issues in general, in the field of IT, outside of it. A few didn't make it, one recently this year. And yeah, so that is also a talk to them, for them. So I would say that IT is a high-risk industry for burnout, anxiety, and depression, more so than other fields. You don't really hear plumbers complaining about burnout. They don't go like, John, he had this problem with his pipe, and now he's all burned out. That's not a thing. We do face a number of challenges in our work. Mentally, our focus is on problems. We focus on what needs to be solved. We need to be perfectionists to a certain degree because compilers will not take sloppy syntax, for example, but also, generally speaking, we're looking for problems. And this focus on the negative is something, as we'll see, that is one of the causes of burnout. So there's this mental focus on what doesn't work. Then physically speaking, when it comes to physical health, generally speaking, the way we spend our days is mostly like this maybe, and then you have the coffee mug here. And that's not a very, let's say, open and healthy way of spending your days. Our bodies have evolved over hundreds of thousands of years for walking around outside. And now we just spend all the day inside watching a screen. That's one thing that doesn't help. And then emotionally as well, like we always play catch up. This industry is moving really fast. You have to sort of be there. If you just don't look for a moment and then you have Clippy and your IDE telling you that you're absolutely right. This industry is moving really, really fast. So that's one of the stressors as well. Now, a few expectations for this talk. This is not about avoiding burnout. I don't know how to do that. But it's one of these talks that I wished I'd seen before for the recovery part. So that's one place where it could help. Another thing here, humor is really important. When you're facing depression, when you're facing anxiety, all of this, humor is something that really helps. If you go see the online communities for depression, it's full of memes like this. And that's what we like to do. It's helpful. So you're allowed to laugh during this talk. It's a serious topic, but there needs to be some fun as well in there. The agenda today, we're starting with a few definitions. Then we'll talk about the prevalent treatment for depression, burnout, and anxiety. And then I will talk about a few concrete recovery tools. So let's start with a few definitions here. Burnout. Burnout is a state of emotional, mental, and often physical exhaustion brought on by prolonged or repeated stress. So it's like this empty battery. Symptoms of burnout are emotional exhaustion, feeling drained or overwhelmed, anxiety, anhedonia. Anhedonia means that something that brought you joy before, that you enjoyed doing, you no longer enjoy doing it. That's the definition of anhedonia. Hopelessness, pessimism, irritability, restlessness, lack of energy, difficulty to concentrate or to remember, sleep problems, physical pain without a clear cause. These are all symptoms of burnout. Now, the causes of burnout, here I've ranked them in an order of what I would say the most important to the least important. The first one is perfectionism. which is a focus on the negative because you're always focusing on what's not quite right, okay? And that's a way of looking at your work, but also at life in general, because it doesn't, if you're thinking about this at work 40 hours a week or so, you kind of think in this way also in your life. So perfectionism, lack of agency, perceived lack of recognition or fairness, which directly ties to bad management. Management plays an extremely important role when it comes to burnout in a professional setting. This mentality of without me, nothing would work, feeling the weight of something on your shoulders, like you're convinced that if you're not there to do it, then everything will collapse, sort of. A value mismatch between you and your employer or your client. And then excessive workload and working long hours, which I ranked last year because that's sort of the sort of prejudice that we think, oh yeah, burnout, it's a lot of work. It's not only that. You can work a lot. If you enjoy the work, if everything else clicks, that's okay. But it's when you work a lot and there is something wrong with the work and with the way you feel treated at work, with the fact that you have the feeling that you cannot get out of it, this is when it starts to become a problem, that there is so much work. Now, who knows this sign on a car here, the one in the middle there? Engine problem, yeah. That's the check engine light. So what's this? This is a safety feature, and what happens when this thing is on is your car goes into limp mode, it's called. So suddenly you can't go as fast anymore. And it's a safety feature that's designed for keeping the car from blowing up, or the engine from blowing up. Often it's just a sensor that's wrong on the car, at least you can hope that. But sometimes it's the engine that has a problem and then it needs to be checked. And that's why the car says, hey, you can't drive as fast anymore, because if you do, well, you don't want to blow up your engine on the highway. That's not good. Now, burnout-induced depression is the equivalent to limp mode for our bodies. So it's a safety feature to protect the psyche from further harm by shutting down the body. Okay, it's your psyche that cannot take it anymore. So in order to protect that, the body goes like, whoa, okay, I'm shutting down. They cannot stand up anymore. Let them just like shut them down. And it is a form of depression. It's called burnout-induced depression, and burnout is a form of depression. As we'll see, there is different types of depression, but yeah, burnout is one of them there. A quick sort of intro to my story here. I acknowledge that I did burnout in the February of 22. In fact, I had been burnout for a long time, but well, this is something you can go on and on and on and on, you know. It's something that builds up for years. We had Corona. I'm an independent consultant, so during COVID, many companies, if not all of them, stopped hiring external consultants. They stopped hiring trainers, etc. So that was kind of a stressful time. I had joined a company out of idealism in the renewable energy space, but I noticed too late that the values were mismatched there. Then I switched positions and roles inside of the company to a new field that I didn't master. That was professionally quite a bit stressful, but then also at home, 2 small kids. Plus, we got a new heat pump in the garden and in the basement of the building we're living in for the whole building. And we're living on the ground floor. And that heat pump started vibrating so much so that we couldn't sleep at night anymore. At least I couldn't. So for like months, I was sleeping maybe 3 hours at night at most. And that really accelerated all of it. But it had started before, okay? It is not just the heat pump, even if I would like to pin it only on that one. Then there was more to it. All right. Anxiety. Anxiety is a feeling of fear, dread, and uneasiness, often stemming from the anticipation of a real or perceived threat. Perceived threat is the key word here, because often in anxiety, what you do, you're imagining fake scenarios in your brain and you're worrying about those and you have them in your brain and you're like, oh, what if this happens? And then you're lying at night and you're thinking about these things and you're imagining all the things that could go wrong. And then eventually you go to the meta level where it's 4 in the morning and you're still worrying, and then you're worrying that you're worrying so much and you can't sleep. And that's really a bad place to be in, I can tell you. It's often, related to stress. If you're in this sort of spot, this is anxiety. Now, the first thing here is to become aware of this being actually anxiety. It's like fish in the water. They don't know that they're in the water. If you're anxious all the time, you don't know that you're anxious all the time. And you may say, oh yeah, I'm overthinking things. But really, anxiety is a symptom of depression, okay, also. So this is something serious. And I didn't know that there was such a thing as anxiety and this being, or let's say I didn't know that there was a way to live without anxiety until I didn't have anxiety anymore. I have had years of insomnia, and probably since I was a teenager, it started. I had difficulties falling asleep, waking up at night, having these thought loops, sometimes more, sometimes less. And then the physical symptoms were back pain, tense shoulders, and in extremely stressful situations, tinnitus, so ear ringing. Yeah. Now, depression. Depression is something you can get really good at, okay? And there is no single definition of depression. There is, so I put up a few here. Generally, when we think about depression, we're thinking about the black kind of depression, major depressive disorder, which is a mental state of low mood and aversion to activity. So you imagine someone who is sitting on the couch, doesn't want to go out, doesn't want to go up. That's sort of this black depression. The white depression, according to Green, it's more of an emotional numbness where your feelings have gone to a flat line. So you don't feel sadness, but you don't feel joy either. You're just going through life and it feels kind of empty. So I've had that since my 20s for a very long time. And so generally speaking, depression is something that has many types and degrees, and there is no single definition, but we're going to look at like depression, a few symptoms for the black depression here, which include sadness, anxiety, there's empty mood, anhedonia again, hopelessness, pessimism, irritability, restlessness, lack of energy, difficulties to concentrate or to remember, sleep problems, physical pain without a clear cause, and suicidal thoughts. And if that list seems familiar, it's because the symptoms of burnout are also, many of them are here. It's quite similar, burnout being also a type of depression. The problem then is that the diagnosis needs to be done carefully, because otherwise these two can be confused, and that can be a problem. If you suspect that you might be depressed, or that you know someone who is depressed, or have a close relative who is depressed, I could recommend these two books by Matthew Johnstone, I Had a Black Dog and Living with a Black Dog. There's not much text, there's not much to read, but they're very well drawn and they're kind of gentle and sort of give you sort of a nod to look into that, into healing, basically. Again, you can be depressed without knowing it, like the fish in the water. It's also a thing. There are things like the recurrent depressive disorder, according to the ICD, the International Classification of Diseases, that's the F33 family. I've been diagnosed with pretty much every subset of that family over the years. There is another thing called dysthymia, which is also this low mood, F34.1. But generally speaking, in terms of diagnosis, depression is comorbid with a lot of other mental health disorders. It's really prevalent. There is a lot of depression going on. So yeah, that sort of is a common thing here. Why are we depressed? And one reason for which we might be depressed could be childhood trauma, but there's many different possible causes here. Physical health, if you have poor physical health or pain, that really doesn't help. Genetics, the microbiome, what you have in your gut bacteria, what you eat and how that influences your gut, that plays a really important role. Psychological factors, trauma, so be it childhood trauma, trauma that you've had in adulthood, or PTSD. Inflammation also plays a very important role when your immune system has to work all the time. That directly leads to depression. And that can happen. You can have an inflammation that is there for 10 years, especially in the teeth and in the cavities in the teeth, that can go undetected because you don't feel pain, because there is no nerve there, but your immune system is constantly fighting it. So, these are many different things that can cause it. Stress is one of them as well. The kynurenine pathway. So the kynurenine pathway, it's a major route for the breakdown of essential amino acids in our bodies, which then are metabolized into neurotransmitters. We'll come back to that later. And then social determinants, like in what kind of family you were born, what your social surroundings are like, etc. So many different causes. That's different here is really important. Let's talk a little bit about the state of the art, or maybe not the state of the art, but the prevalent treatment, the general treatment of burnout, anxiety, and depression. So you go see your doctor and you tell them you noticed that you feel burnout. What do you think happens next? What will they tell you? Stay home 3 weeks, okay? Yeah? Take medicines, yes?
Yeah, that's what I was going to say. Take meds.
Take meds, okay. Well, one thing to know here is that in most Western countries, in order to be eligible for support from the health insurance, be it public or private, you need to go see a psychiatrist, especially if you say, hey, I want to stay home more than 3 weeks. Your general practitioner is going to say, I need to go see a specialist, and that's going to be a psychiatrist. So let's go see the psychiatrist. This video now has been recorded by someone in the US who went to see a few psychiatrists and told them the same symptoms every time and recorded what was happening.
I'm extremely unorganized, and I didn't used to be. It's caused problems in the family. It's caused problems getting, I'm self-employed.
So you've got ADD, ADHD, you're depressed, and your depression is bipolar depressed.
You have a brain chemistry disorder that's probably genetic.
You have a lot of the symptoms of depression.
So it seems like it is a mixed picture. What that means is like we got some depressive symptoms and some, high symptoms.
If you're bipolar, I'll need to give you a mood stabilizer.
Considered low-grade bipolar.
You are more of the ADD and ADHD.
And as far as medications for depression, because I would recommend that you start a medication, which are Prozac, Zoloft, Paxil, Celexa.
Usually propylene XR is pretty good.
They'll give you some Lexapro in the morning and some Trazodone at night.
Lamictal is a better medication for that. It works on your depression also.
But the treatment for any bipolar cycling is the same. The lithium,
Bremron is another one.
trazodone,
Tegretol,
Depakote,
Wellbutrin, and
Lexapro.
Lamictal,
Equatroid,
Depakote,
lithium.
Ambien.
You may need an antidepressant also with your Lamictal.
We don't know if I give you a medication if it is going to work or not.
To a certain degree, it's trial and error.
So to a certain degree, it's trial and error. And we know this. We do it sometimes. It's called testing and production. So yeah. The thing here, though, is that, antidepressant use is on the rise. This is a graph from 2011. The figures certainly changed. And what we can see here is a group of, let's say, 40 to 59 years old. There is 15% of people taking antidepressants. My question here is, do they work? And so I've researched that questions to quite some extent, and let me share some of the results here. The first thing I would like to say is the effectiveness of antidepressants. And there was a few studies done with the question, what research on antidepressants does the FDA, the Federal Drug Administration, publish? And they looked at all the research that was published, and they found that the subset of the research on antidepressant effectiveness, the clinical trials that were published, in 94% of the cases, the antidepressants were had a positive impact. And then they also looked at all the research that had been done, not just the one republished by the FDA. And then they found that that means that figure dropped to 51%. So if you take into account all of the research, not just the one handpicked to show that shows that antidepressants are working, you have 51% effectiveness of antidepressants, which is a bit like, why would the FDA do that? We'll come back to the money later, yeah. Now, how do antidepressants work? If you go see a psychiatrist, and 2 out of 3 of them, when I went to see them, they told me this: chemical imbalance in the brain. You saw it in the video. I've got that verbatim from the psychiatrists. It's a chemical imbalance in the brain. But what chemical imbalance? Well, there is this theory that was formulated in the 1960s, which is that serotonin insufficiency, it's a neurotransmitter, serotonin. The insufficiency of serotonin causes depression. That's the theory. And so as a result, most, if not all, modern antidepressants are called SSRIs, selective serotonin reuptake inhibitors, and SNRIs, selective noradrenaline reuptake inhibitors. And yeah, so that's what everybody tells you. And then there was this study done in 22, which is an umbrella study. What they did is they looked at all the research that had been done since 1960 on serotonin and depression. All of it. And they went over it with a lot of statistics. They also looked at 100,000 genetic samples. It was a lot of work. And the result of that study was that there is no convincing evidence that depression is associated with or caused by lower serotonin concentration or activity. What? Now let that sink in just for a moment. There is no scientific link between serotonin and depression. And yet, all the modern medication, the most common modern medication for the cure of depression is based on that theory. That doesn't mean that you should abruptly stop taking antidepressants. I'll talk more about that later if you're taking them. But that kind of finding is a bit scary because that sort of leaves us with the question: why do psychiatrists keep on administrating it? Why are we sort of at this state? Now, there is another set of studies that has been done, and that is on the placebo effect. And it turns out that for antidepressants, the placebo response is 82%. Just to say, if you take if one of these random trials, you give one group, you give them an antidepressant, the other group, you give them a sugar pill. In 82% of the cases, the sugar pill has the same effect as the antidepressant. And I have nothing against the placebo effect. I think it's great. If you can trick your brain into thinking that, it is better, you're going to feel better, that's really good. And there had been thoughts about using antidepressants as an active placebo. The problem with antidepressants is that there are side effects. And as we've learned from the functional programming folks over the past few years, is that side effects are bad. Okay? Shouldn't have side effects. They're not good. Let's look at a few side effects. And for this, we're going to look at the notice of one of the most commonly prescribed antidepressants out there, citalopram. Nausea, diarrhea, constipation, vomiting, stomach pain, heartburn, decreased appetite, weight loss, increased sweating, increased thirst, frequent urination, difficulty falling asleep or staying asleep, drowsiness, excessive tiredness, yawning, weakness, uncontrollable shaking of a part of the body, muscle joint pain, dry mouth, sexual problems, decreased sex drive, heavy menstrual periods, and runny nose. Chest pain, shortness of breath, dizziness, fainting, fever, sweating, confusion, fast or irregular heartbeat, severe muscle stiffness or twitching, agitation, hallucinations, loss of coordination, nausea, vomiting or diarrhea, coma, hives or blisters, rash, itching, difficulty breathing or swallowing, swelling of the face, throat, tongue, lips, eyes, hands or feet, ankle or lower legs, hoarseness, unusual bleeding or bruising, nose bleeding, headache, unsteadiness, problems of thinking, concentration or memory, seizures. Okay. So the first slide here, this is sort of what's expected. That sort of is, yeah. In this case, second slide, if you experience that, you should go see your doctor. I don't know how you go see your doctor if you're in a coma, but yeah. So that's pretty common. This is how the notice looks like if you print it out. And, there's this square box on the top. Let's look at the square box here. Warning: suicidal thoughts and behaviors. Increased risk of suicidal thoughts and behaviors in pediatric and young adult patients taking antidepressants. Closely monitor all antidepressant-treated patients for clinical worsening and emergence of suicidal thoughts and behaviors. What? So now you're taking a medicine that's supposed to treat your depression and may make you feel want to kill yourself, basically. What I find, this is the point where I say this is extremely unethical. And I'm pointing also out that, you know, there should be, they say, you know, clinical worsening. How do you monitor that if you're living on your own alone and you're taking this? Who is going to monitor your dog? Who is going to... So this is my biggest problem with this medication, is that it shouldn't maybe be prescribed outside of a clinical setting if that is the danger you can have with it. And they talk here about children and young adults. 2 days after that I started taking this medication, I started to have suicidal thoughts. I don't know, do I qualify as a young adult at 39? I don't know, and I'm not the only one. I've talked to many people in you know, groups and so on, and yeah. Now, going back to the topic of money, in July 2012, GlaxoSmithKline paid a $3 billion fine to the US government to resolve criminal and civil liabilities for promoting antidepressants like Paxil and Wellbutrin for unapproved uses, particularly in children, and for failing to report crucial safety data about the diabetes drug Avandia to the FDA. I mean, I don't know what you expect from a group called GlaxoSmithKline. But in generally, pharma companies have paid over 30 billions of fines for lying about the effectiveness and side effects of drugs in the past 20 years. I let you draw your own conclusions on this, but there is a link here. Yeah, so in conclusion here, we have a treatment with antidepressants that is effective in 51% of the cases, out of which 82% is a placebo response. At best, it will kill your libido. That psychiatrists tell you this, oh yeah, if you take this, your sex drive will be gone. Yeah, but at worst, it can cause suicidal thoughts and depression. That's not one of this. Depression is not a side effect of citalopram, but in other antidepressants and SSRIs, one of the side effects is depression. Of an antidepressant, the side effect is depression. I mean, yeah. Now, if you have a burnout, do you really have to take medication when you burn out? And in the wise words of the Wolf of Wall Street, absolutely fucking not. If there is one slide I would like you to remember, you can forget all the rest, if there's one slide I would like you to remember, it's not this one, it's the next. Using antidepressants to treat burnout is like commenting out broken tests after a code change. Doing a change in code base, tests fail, it's like, what could possibly go wrong? That engine light, let's put a tape on it, what could possibly go wrong? The thing is that there is no quick fix. There is no way. This is something that builds up over months and years. You're not going to fix it by taking a pill. And in fact, it can make things worse. So yeah. So in my case, what happened is that when I acknowledged that I was burned out, in fact, a colleague pointed out that I might be, you know, that they had this other colleague and that they had burned out. And there's online quizzes that you can take. I took 3 online quizzes and I scored perfect matches on these. So you can Google for these quizzes and they're pretty good. And if you have a perfect match, it means that, yeah, you burned out. So I went to see my GP and they prescribed a low-dose antidepressant for sleep called Tritico, which makes you very dizzy. And so you're still awake at night, but you can't really think. So yeah, it doesn't really help that much, but to some extent it does help. Then I went to see a psychiatrist because I had an appointment because I wanted help with the sleep part because of that heat pump, okay? But by the time that the appointment happened, which you need months to get an appointment often, I already had sort of this result of the burnout quiz. So they prescribed an SSRI and a few other pills. And the result of taking that SSRI, instead of me resting and taking it easy after all of this exhaustion, was that I decided to remodel our bedroom, because that's what you apparently do when you take antidepressants. They can be extremely activating, which is the opposite of keeping your body resting to recover. Was I happy during that time? No, that is not the face of someone who is happy. The symptoms got worse. I got many of the symptoms on the first slide, then I get some of the symptoms on the second slide. The psychiatrist kind of wasn't reachable, yelled at me once. They're really weird people. Some of the psychiatrists are really weird. Then I went to see a second psychiatrist. Again, you know, you have to wait months to get an appointment. So I found one where it was faster. I waited 3 hours in the waiting room, got in there, was there in there for 5 minutes, couldn't finish a single sentence, told them about the symptoms of dizziness and so on. They prescribed an MRI, because obviously it wasn't the medication, it was my head that was wrong. And then prescribed another SSRI. I had sort of weaned out the first one. Meanwhile, so that's one thing. If you are on an antidepressant, you should really not stop taking it at once. That's a really, really bad idea. You have to sort of go gradually and very slowly. And there are withdrawal symptoms. Not for everyone, but for 50% of the people, there are withdrawal symptoms. And that was 3 weeks that were really, really rough. So I would, if you are going off of these meds, you can have really a rough time for that. Finally, I found a third psychiatrist which prescribed one of the older antidepressants, and that made me extremely tired, and also I couldn't sleep at night. But at least I wasn't running around renovating the whole house, so I could rest for a bit. But I was so tired that I couldn't do sports anymore, I couldn't play with my kids anymore. The dosage was increased, I didn't feel happier, felt sadder and sadder. And then it came the summer, and we had decreased the dosage to switching to another thing. And then there was a point where I didn't take the old one anymore, and I took only a bit of the new one, and I felt really happy and fine. And then after 1 week, the new one started to take effect, and then I couldn't sleep anymore, and the psychiatrist said, yeah, now you have to take medication to sleep as well. And that's when I called bullshit on this approach. And this is where I want to talk about alternative treatments here than medication. Okay, at no point during the treatment did I feel that feel any better about any of this, and I think this really set back recovery of at least 6 months. So, is there a better way? Yeah, there is a better way. So let's talk about a few tools here that you can use for recovering from burnout. The first one, that's psychotherapy, which you might have heard of. And psychotherapy is something that does take courage to start, because you're like, there's nothing wrong with me. I'm not crazy. And it's not about being crazy, really. And there is this stigma, but it's sort of getting better in our society slowly. It might take time. I've done over 10 years of therapy in total with different therapists. And there's different types of therapy: concentrative movement therapy, cognitive behavioral therapy, mindfulness-based cognitive therapy, internal family system, etc., etc. Read about them if you're considering it. See what fits you best. If you're very much in your head, maybe take something that makes you interact more with the body. In some cases, you may say that currently you don't have the capacity to deal with all that trauma or whatever you've had. Then you can take a very pragmatic approach like the CBT, the cognitive behavioral therapy, which only focuses on your behavior, not so much on the underlying causes. There's an internal family system, which is really great in my opinion. But yeah, read about them if you're considering that. There is a lot that you can do. Now, there is one very important thing for therapy to work, is that you need to have a good connection between you and with your therapist. There needs to be a good emotional connection. There needs to be trust. Otherwise, you're just wasting your time and money. It's like don't do it. And a good therapist will also point that out. Usually you go there, you do a few appointments, you see how it goes, and if it doesn't work, you'd switch. Now, the thing is, if you don't have the money, if you have to go through the public system, that can be really frustrating because often you need to wait for months. But if you have the privilege and have the money to pay this therapy out of your pocket, then you can do that faster usually. All right. A second thing here, MBSR, I like four-letter acronyms here. It's mindfulness-based stress reduction. This is a methodology that's been developed by John Kabat-Zinn from the Massachusetts Medical School, and it's very pragmatic. You start with an 8 weeks program that is designed for learning about mindfulness. So basically what you do, you learn about mindfulness and meditation, different types of meditation. And the effects of that are really, really positive. It reduces stress. It has long-term effects on the inner calm, on coping mechanisms and relationships. And generally speaking, it's a long-term really good positive effects, especially when you have a lot of stress in your life. I try to meditate every day, even if it's just for 5 minutes, to keep the habit. It's very easy to do. You just go and breathe a little bit and feel in your body. It's so easy. Yeah. The other thing here, the four-letter acronym that I want to talk about, this is cool and geeky. It's TDCS. It's the transcranial direct current stimulation. And that is exactly what it sounds like with the current. Where I found out about it was, oh wow, you cannot read. I have so many sources, you cannot read the text anymore. But I heard about it on a Radiolab episode called 9-Volt Nirvana. And what happened in there is that this lady on the picture here, a reporter from the UK, she heard about the US Army, DARPA, doing research on how to speed up learning. And what they were trying to speed up the learning of was for soldiers to shoot better. So she flew over there, and she has this little thing on her head here. When they switched that thing on, although she was not experienced at shooting, her accuracy went up to 100% for the shooting. The way it works is by stimulating neurons. And in the case of depression, it targets the left dorsolateral prefrontal cortex, and that is a part of the brain that's shown to be much less active when you have a depression. Okay? And it's the part of the brain that's responsible for planning and action. And when you're depressed, that part is just flatlined. It doesn't really work. So what you do, you activate that part. And by activating that part, then you can start to get up, get out, do stuff, and feel better through that. Same idea as chemical antidepressants, but without the side effects. Here, there is one thing, you can do this yourself at home. There is one from Flow Neuroscience, which at the moment costs €459. When I bought it was 300 and something, thank you inflation. And it has a proven effect that's greater than placebo and greater than the 18% of antidepressants. There is almost no side effects, except for the itching that you have sometimes from this electricity on your skin, but I take that anytime over loss of sexual drive and coma. I'm not getting any money for this slide, by the way, but I want to point out that this has been extremely effective in my case. This is my Montgomery-Asberg Depression Rating Scale, MADRS, in the first few weeks of taking that, of using that treatment. And you can see the depression score going like down. It really, really works. I've recommended it to quite a few people and they have all reported similar results. This is really promising. Now, there is one obvious thing you can do that your doctor should point out. It's exercise. And we're all like, yeah, really? But now, the good news is there is a study that shows that it works from 24. And what they did in the study, they looked at different types of exercises and how much effect it had on depression. SSRIs down here, barely doing anything at all. And then you've got walking or jogging, like just walking. You can cure depression by walking. So if you have a burnout and you want to feel better, one thing you can do is walk. You don't even have to run. You can just walk. That really does help. But the thing that helps the most is dancing, which is a great thing for us, because when you ask ChatGPT if people in IT are good at dancing, we really are, and there's synergies and things are really great. So I would say, look at this. What I found, I've done a lot of functional programming, so obviously I went for functional training, which is a type of exercise that is a bit like CrossFit minus the uncontrolled doing it until you really are lying on the floor part. You have more control of how hard you train. You train at your own pace in functional training. It's in a group setting, so it maximizes motivation. And it also helps with, back pain, because suddenly you have muscles in your core and in your back, and then that helps with that sort of work. The other thing that you can do is yoga, which develops not only strength, but also dexterity, and generally speaking, opens up your mind, because we're all like this, and you can go like that. And after 6 months of yoga, I'm proud to show that I can do this now. This is what I can do. This is what, thank you. This is what a career in IT will do to your body. You become really short. Maybe in 20 years I can do that, who knows. But yeah, if you can do something for your body, it's really a thing that the younger you start, the better it is. Alcohol. So we're at Devox in Belgium. While researching this talk, I found this new term called anxiety, which is a stonking hangover that also makes you really sweatily worried about what you did and said the night before. Yeah. So it turns out that alcohol consumption is often a form of self-medication. Okay? Many cases. There's a link. People, we do it. It's socially acceptable. Okay? And then the problem with that is that the more you drink, the more depressed you get. There is a link, there is a studies, it's one-on-one. You might have experienced it, you have this hangover, and then you feel a bit low the days come after. So when I was on the lookout for finding, treatments for depression, I sort of decided for myself that I will no longer drink. So I've not been drinking for 2 years and 3 quarters, and I'm part French, so no more red wine. So that was tough, but I'm still there. And I know, we're at Devox, there is all these nice Belgian beers, but, it's just a choice in the end, and how much pain you feel from it all. If you really want to take medication, a pill, take this one. It's called St. John's Wort, and it's been known for thousands of years. You find it in historical scriptures. And it has very little to no side effects. You should read the notice, especially if you're taking an antidepressant already, because it does interact with that. It can have negative side effects on this. If you don't take any medication, you can take this. If you want it to be effective, you should be taking the version of it which has 900 milligrams per day. Otherwise, it's not, So yeah, you have to see if you can get it in your country. In Austria, you cannot get it for without a prescription for over 450 milligrams. So yeah, it's one of the things. There's other tools that I would like to mention, but I didn't really have time. I thought I wouldn't have time to talk about them. Regular journaling, writing down each day how you've been feeling, what has made you happy, what has made you feel sad. That really helps. Another tool is neurofeedback. which is a machine that, or a computer that records your activity of your brain while you get exposed to a monitor and to sounds. And then there is a signal injected in that, and you sort of learn to reprogram the brain. Okay, this is pretty cool stuff, this one. Medical ayahuasca, I say medical, not the one where you fly in the jungle and have a shaman chanting and so on. There are more, and there's research. So there's a link to the paper in the end. There is research that shows that this really helps with depression in a very significant way. Okay, and there are versions of ayahuasca that you can do that don't have the psychoactive substance that makes you hallucinate, but substitute that with another root or something that activates your brain's own mechanisms for that. And it really is positive, but obviously Big Pharma doesn't want to hear about that. A healthy diet and no sugar, or less sugar, let's say, no sugar being ideal, or no artificial sugar. The diet really plays an important role. We kind of really underestimate how much what you eat affects your mood. It's insane. But of course, you have to take time for proper cooking and caring about yourself then, yeah. There are supplements that you can take as well, but don't just order anything off of Amazon. No. What I've done is I've done a genetic test and blood tests and so on at an expert, and based on that I had a whole treatment for supplements, which then change your gut and as a result also change your mood. Neurogenic tremors, yeah. Some advice here: if you go see a psychiatrist, do discuss alternative treatments to antidepressants, please. If you're self-employed, get a private insurance that covers burnout. I had one, so it did help me a bit until they kicked me out, because that's what insurances do. The moment they have to start paying, at some point they kick you out. It's in the clause. It's fine print, you have to read. The Body Keeps the Score by Bessel van der Kolk is a really great book, so I can recommend that. Some final thoughts here. Burnout is a chance to change to something fundamental about your life. If you burn out, if you are in that position, and if you're going to stop working for months or a year, use that time and reflect and make a change. We have this one life. It might be, you don't just burn out like that. It's because the way you live your life that you burn out. It's a warning sign. So use that time. It's a chance. And then also, there is a way out of depression, okay? If you're depressed, there is a way. Know that there is a way. It's not always like that. I've been very, very low over the years, but now I'm here. I'm pretty happy. Depression, anxiety free for some time now, and I can tell you, yeah, that it does. That there's a way out of there. These are the papers and things I've read while preparing this talk. Yeah, thank you. Do you have any questions? Yes. Yeah. Yeah, okay. So, okay, so yeah, the reason is, so What you're saying is if you take antidepressants and they flatline your emotions, and that's why you may have this risk of suicide because suddenly your identity is changing. Yes, that depends on the type of depression you have. If you already have no feelings to start with, there's that. But also, that's not what the science shows. And I've heard this many times, this story. That's what psychiatrists say, that first it gets worse and then it will get better. But what the science shows is that this is not the leading cause of the suicidal thoughts in there. So there's a big discrepancy between the state-of-the-art research about depression and the practice of treating depression, which is really staggering. It's like, yeah. But we can talk about that more. Thanks. Any more questions? Sorry? I cannot really see. Yeah? If anyone has a question, I don't really see you guys, so just speak up. Anyone? Am I still working in IT? No, I'm a plumber. No. I'm still working in IT, yes, I am, yeah. Yeah. It didn't scare me away enough. Mm-hmm. It's about awareness, really. And if you notice that someone is on the brink, you have to help them realize it for themselves. You will notice a decrease in performance. Someone who has been really high performer, etc., and suddenly they perform less and less, and then they get even fewer. That is a definitive symptom of burnout. Yeah.
Can I just pitch in there? I actually experienced the problem with my management. I was on a project working with a customer. I ended up in hospital twice in my career with stress symptoms. And I asked if I could be moved off the project and replaced. And management said no. If you hear cries for help, never ignore them.
Yeah. More questions, comments? Just speak up because, yeah.
I just want to say thank you. It takes guts to stand in front and talk about your own depression.
Thanks.
Nice.
Yeah. Yeah. Mm-hmm. Yeah. Yeah. No, that's a good thing. If you have someone who looks out for you, then definitely that. It's a lot about boundaries as well. And one of the things you learn in recovery is about setting boundaries. Because if you say you're a very high performer and people are used to you working at evenings, weekends, whatever, they will expect that from you always. And that's why often when people have burnout, they will not come back to the company where they had the burnout. Because turning that mindset from the other colleagues, the other people in the company around is really hard, especially when you're struggling with setting boundaries. It's easier to go someplace else and to set boundaries there from the start. Yeah. Okay, I think we're out of time, but if you want to talk, I'm here. So, you can reach out and also send me an email or something. Thank you.